When I heard that ACT was closing, I felt very sad. I felt concerned.
AIDS Committee of Toronto was founded during the AIDS crisis in 1983, a time when HIV was highly stigmatized and associated with long-term illness or often death.
It was a community-driven organization. It was driven because of government ignorance, government fear, government priorities that didn't care in the same way about the lives of people who were at risk for HIV.
Since then, there have been major advances in HIV medication and prevention efforts, which ACT says has contributed to a reduced demand for its services, leading to the decision to close after 4 decades.
In addition to that, we sit with financial challenges, as most nonprofit organizations do in 2025. Fundraising is more difficult. Government funding has its limitations and its in its ability of what we can and can't do.
But the closure comes at a time where HIV cases across the country continues to rise, as Public Health Canada recorded 2,400 new HIV diagnoses in 2023, marking an over 35% increase since 2022. Meanwhile, here in the city, Toronto Public Health recorded 512 HIV cases in 2022, 703 in 2023, and 446 in 2024, with officials saying these case numbers highlight the ongoing need for access to HIV testing, treatment, and prevention.
I do see this as being indicative of larger cuts in social and health services. And it is worrying. We are still having over 2,000 new infections every single year, and they're disproportionately affecting communities who face multiple sources of marginalization.
Experts agree there are deep social inequities like anti-Black racism, homophobia, misogyny, and stigma, all driving our current state, which they say needs to be addressed.
I believe that the government is not doing enough federally and certainly provincially, not doing anywhere near enough to address those issues, to prevent the closure of an organization that's been a backbone of much of the response and the community response.
As for ACT's nearly 500 service users, LISC says many of these individuals are already connected to other HIV organizations in the city. And in a statement to City News, Ontario's Ministry of Health says in part they'll work to ensure there are no gaps in service provisions.
While ACT is stepping back and closing our doors, that does not minimize the needs of HIV services and continued work of our partner organizations that are doing amazing work.
Before the organization shuts down, officials say they plan to hold a community event. Now, details of that event are expected to be announced next year. In Toronto, Rhianne Campbell, City News.